Good day! So for today's video, we're going to conduct the return demonstration about the proper cleaning of eyes, ears, and nose of an infant. So babies are susceptible to illness during the early stage of their development because their immune system are not sufficiently developed. Therefore, we should observe proper hygiene to keep the baby's environment clean and germ-free to reduce the risk of exposing their fragile bodies to disease-causing pathogens. So, it is really important to keep babies clean and healthy.
So here are the materials needed in cleaning the eyes, nose, and ears of an infant. So first, the ears. The materials needed are, first, you need a washcloth or cotton balls. Second, a bowl. And third, warm water. And in cleaning the eyes of an infant, you only need a sterilized wet wipes and a bowl with warm water. Wow! Bagong ligo ng aming baby! Okay, dyan ko muna baby ha. Okay, nilinisin muna natin ang tenga ni baby. Ano? Mukhang namumula nga yung ano mo baby. Nay! 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 Oh. Kasi Nay, yung tenga ni baby Nay parang namumula eh. Ha? Tingnan mo nga Nay, saglit.
Ano ba ginawa mo?
Hindi kasi Nay, parang namumula, di ba?
Ano ba talaga? Ano ba kasi ginamit mo dito?
Kasi Nay, gumamit lang naman ako ng cotton buds at saka cotton. Nay, mas mabuti pa ipa-check up na lang natin sa doktor si baby Nay.
Hala, sige. Magligpit ka doon at pupunta tayo sa doktor. Bilisan mo dyan.
Baby, magliligpit mo na ako na ya. Baby. Good morning, Dok. Good morning. Ano po ba nangyari sa bata?
Namumula kasi ang tenga ng aking apo, Dok. Ano ba nangyari dito? Dito,
Guys,
Dok. Oh.
Let me check. Baby. Ano po bang ginamit yung panlinis sa tenga ng bata? Ano po, Dok? Ang ginagamit ko po ay cotton buds at saka cotton. Pero hindi po talaga advisable na gumamit ng cotton buds sa paglinis ng tenga ng mga bata. Lalo na sa ganito kalit na bata. Kasi maaaring mag-clog yung mga earwax sa loob ng tenga ng bata. So, para maiwasan ito, bibigyan ko na lang kayo ng mga tips kung paano ang proper na paglinis ng tenga ng bata. At additional rin doon ang sa mata, yung proper na paglinis sa mata at ilong ng bata.
Oh, sige, Dok.
Salamat po, Dok. Ano po, Dok? May gamot po ba kayo na ibibigay dito sa baby namin? Meron akong gamot na ibibigay sa kanya, pero parang ipapahid nyo lang siya sa outer sa tenga ng baby para mawala yung pagkakas niya. Sige po. Maraming salamat po, Dok. How to clean baby's ears? To clean your baby's ears on a daily or regular basis, you'll need a cotton ball that's been soaked with warm water. You can also use a gentle washcloth with some warm water. To clean baby's ears, first, wet the washcloths or cotton balls with warm water. Second, wring out the washcloth well if using. And third, gently wipe behind ear and around outside of each ears. Never stick the washcloth or cotton balls inside your baby's ears. This can cause damage to the ear canal of the baby.
cleaning the nose of the baby, all you need is to have a hypoallergenic wet wipes, or you can use sanitized cloths soaked in the warm water. If the baby has cold and having difficulties in breathing, you can use nasal aspirator to suck the fluid blocking the baby's nose. Eyes are especially sensitive and should be cleaned with safety. Your baby's skin is much thinner since adipose tissue is scarce and has little subcutaneous fat, which is why special hygiene habits should be carried out. Good eye hygiene can prevent the development of future eye infections. Newborns tend to have a lot of rheum and scab because they produce a lot of mucin and mucous fluid that serves to moisturize the eye. Moreover, newborns live for a long period of time, boosting the appearance of these residues. When substance dry, sediments appear on the outside of the eye and eyelids. In addition to that, this type of secretions and lack of lacrimal drainage facilitate the appearance of eye infection. This is why it's important to keep good eye hygiene in babies. How to clean a baby's eye. Here are some tips on how to clean the eyelids and eye of your baby.
Before cleaning, it is important to wash your hands with water and neutral soap to avoid infecting the baby's eyes. You should never wipe the eyes with your hand, cotton or cloth or paper handkerchief. A sterile object must always be used. Never separate the eyelids from the baby when they are dry. Before separating them, eyes should be moistened. The cleaning should be carried out with a sterilized wet wipe or gauze in order to soften the scabs and facilitate the extraction of secretion. Never rub or scratch if they do not disappear, as it could damage the baby's eyes. Psychological serum will be used to moisten the gauze. In case of not having serum, you could use boiled water once it is warm. The eye should always be cleaned from the tear duct to the corner of the eye so that the debris is dragged out. The baby should be lying on his back. It is recommended to clean the eye of the baby a couple of times a day. After waking up, that is when there is a greater accumulation of secretion.
So ngayon, base sa inyong nakita na demo na ipinakita ko sa inyo kanina, sana may nakuha kayong mga aral galing doon, at sana may apply nyo ang mga aral na yon sa pag-aaruga nyo sa inyong anak. Salamat po, Doc. Maraming salamat.
Hygiene is the most important condition in terms of human health. It is especially important when it comes to your baby, who is very vulnerable to germs and viruses, as his or her immune system is not like the immune system of an adult. One of the best ways to avoid infections is to be prepared, especially if your baby is high at risk. So always practice proper cleaning of your baby's eyes, ears, and nose to avoid any possible infections.